Hi, my name is Dave Jansen, and I'm pleased to welcome you to Fox Valley Plastic Surgery and to specifically talk with you today about veins and vein treatment. Dr. Dubeck and I are both plastic surgeons, but as we started our practice, we really decided we'd do only plastic surgery in our practice, and so having done a lot of varicose vein surgery in our residencies, neither of us wanted to deal with the larger varicose vein operations that involve a lot of pain and swelling and problems long term, and so plastic surgeons in general don't do varicose vein surgery. We, however, found that we were treating a lot of patients for spider veins and then little larger spider veins and small varicose veins in their lower legs, and a new technology came about that allowed us to really look at varicose veins in a different light and treat the larger varicose veins and even the whole leg veins, so that now we've developed a program of really what we consider total vein care for our practice. Total vein care involves dealing with the larger veins of the legs and dealing with even the very large veins in the thighs and calves and what are considered varicose veins rather than just spider veins. This means that we're dealing now, instead of dealing with patients on a one-to-one or cosmetic basis, we're dealing with patients on a insurance-covered basis because we're dealing with larger and therefore symptomatic or medically indicated procedures. Most of the procedures I'll talk about today, until we get to what we consider cleanup issues, are procedures that are covered by insurance. Every single one of them has told me after they've had the first leg done how much better their leg feels, how much less heavy, how much pain, even stinging that people have in their veins before this goes away having had this procedure performed. So I'm becoming very much a big believer in doing this procedure, and it really is helping a lot of people. The reason people come in may be unrelated completely to the way their legs look. A lot of people are coming to us now saying, my legs are just heavy. They are painful. And they're really ending up with a great result through this venous closure technique. The old way of doing this, again, was by basically stripping the vein by putting a wire up the length of the leg and pulling the vein back, basically pulling it inside out and ripping it out. That was a procedure done in an operating room under a general anesthesia, with lots of long-term issues and pain and problems and bruising and time off of work. This procedure basically shrink wraps the vein while it's sitting inside the leg. We put a wire up the length of the leg and are able to close the vein. By closing it, I mean shrink wrapping it from the inside with heat. We do that with the leg numb, we do it in the office, we do it under local anesthesia with a little bit of oral sedation.